Good morning, everybody. It's 11 minutes past 7 o'clock right now, and time for the Orthopedic Minute. And you know we're talking that. We're talking DMOS, Michelle.
That's right, and we're talking arthritis here this morning. And here to tell us, we have Mark Isaacson joining us here this morning, along with Steve Brill. Welcome. Thank you for coming in this morning. You guys have great information to share, and I know there's a lot of people watching that can probably identify with either themselves or somebody in their family.
Of course, Dr. Mark from DMOS, and also the medical honoree for the 2019 Jingle Bell Run, which is very cool. And of course, Steve Brill from the Arthritis Foundation. You're executive director.
I am.
And my old boss, by the way.
He has lots of stories to tell.
Yes. Zip it, Brill. Zip it.
We're not allowed to talk about that.
But let's talk about arthritis, because really it's affecting more people and affects more Americans than people really realize, doesn't it?
Absolutely, and thanks for having us, Michelle. We appreciate it. Yeah, arthritis in general, big umbrella of patients that are incorporated. In America alone, there's 54 million people or more that are affected daily by arthritis. So,
now, are these people that are diagnosed with arthritis?
Good question. Yeah, medically diagnosed. So there's probably more than the 54 million out there, because these are just people that a doctor has told them have arthritis. It's that frequent of a diagnosis. And that includes just the adults we're referring to, and unfortunately, arthritis isn't limited to just adults. So it also affects over 300,000 children in America, which can be quite debilitating to the younger population as well.
Okay, let's talk about what this is.
Sure.
What is arthritis, Steve?
Arthritis, it affects your joints, and it's a debilitating disease that affects the joints and slows your movement.
Mm-hmm. And again, it can hit you at any age. Like you mentioned, doctor, you said kids have arthritis. How young of children are we talking here?
You can go all the way down to in their very early years. Juvenile arthritis, as we call it. There's numerous forms. And a little bit to answer the question that you just asked Steve too, in terms of what is arthritis. In some way, shape, or form, arthritis is an inflammatory process. So the younger you are, usually we call them inflammatory arthritis. So rheumatoid arthritis, psoriatic arthritis, those are the kinds of inflammatory arthritis that we're referring to.
How many different kinds are there of arthritis?
Great question. Numerous, hundreds.
Really?
Yeah, there's more common ones that we've all heard of, some of the names I just said, like rheumatoid arthritis. The most common is osteoarthritis, which is just a wear and tear arthritis, meaning as we age, more of the adult population, we wear out the cartilage in our knee, or in our joints, let's say.
Okay, is that the #1 spot that people notice it?
It would be, correct. So the #1 joint replacement, meaning arthritis leads to surgery oftentimes, is your knee. So that's probably the most common culprit, but every joint in your body can be affected for sure.
All right, now, how do we know if we have arthritis, or it isn't just from overdoing it a little bit?
Great question. So there's classic symptoms that we talk to patients about that usually lead them into my office. A lot of that is joint stiffness or joint swelling, and that's the inflammatory component of arthritis. In addition, I think probably the #1 complaint is pain. Patients come in either painful hip, painful knee, painful ankle, whatever the joint is, but swelling and stiffness are often associated with that pain. And I describe arthritis to my patients as it's not a process that you pick up. It's not the common cold, oh, I got arthritis. It's a process usually that you develop over time, and it's the loss of the cartilage in whatever joint we're referring to. So when you lose that cartilage, pain usually develops.
Are there things we can be doing to prevent this from happening?
Great question, yeah. And so some of the conservative things that we try to do, unfortunately arthritis isn't curable, so we don't have a way to say we're going to get rid of arthritis permanently. But things we can prevent it or slow down its progression would be activity modifications. So avoiding activities we know cause pain or affect our joints. Weight loss, the less we carry, the easier it is on our joints. Mm-hmm. And then there's other conservative treatments, the anti-inflammatory medications, the over-the-counter supplements that patients often ask us about. Those all help with symptoms, but we just don't have a way to reverse it or fully cure it.
What about for when it's in children? Is there a way to help manage that?
We're trying to slow down the progress or the process of arthritis in children. We still don't have a cure, and a lot of that is medication. So whether it's a rheumatologist or a pediatric arthritis specialist, there are medications that are commonly autoimmune anti-inflammatory medications, but we just don't have a way, unfortunately, to stop that yet.
Now, for pain when it comes to arthritis, is there any first line of defense, first line of assistance you can offer someone or suggest?
Sure. And so the most common is over-the-counter anti-inflammatories, so the Aleve, ibuprofen, Tylenol, those types of medications.
Still, to this day, those are the ones those are your go-tos?
Those are, correct. And I shouldn't say Tylenol is an anti-inflammatory. Good pain medication, but doesn't have the anti-inflammatory
Turmeric,
effect.
is that a good?
Yeah, turmeric's another one, exactly right. So they all fall in the same kind of classification of anti-inflammatory because we're trying to knock down that inflammation that commonly comes with arthritis.
So I'm going to follow up on what Michelle just mentioned. So your diet could really affect the way your arthritis is affecting your body.
Absolutely, and that's where some of the patients come in and ask about those supplements like chondroitin and glucosamine, and you hear terms like that. And that's stuff that you can get in your diet, or the vitamins that help our knees or joints feel better. But unfortunately, it's just more symptomatically, once again, treating what is present.
What are some of the foods maybe that are that kind of add to that inflammation, as well as some foods that maybe help
Sure.
decrease?
I don't know if we have a great food that helps decrease. That's a good question. I wish I could point patients to one aisle in this grocery store and say this will make your knees feel better, but we don't. The foods that sometimes make them feel worse, we hear of things like gout and whatnot. Those are high in whether it's red proteins or alcohol consumption. Those sometimes can really flare up types of arthritis that patients have.
Right, but then the ultimate is if it's really severe, you're talking surgery, right?
Absolutely. So I know we often go through with our patients the conservative approach first, which is a lot of what we just talked about. Eventually, oftentimes it gets beyond that, and that's when the cartilage has fully been worn out. And then there's a whole kind of spectrum of surgical treatment, which could start with arthroscopy, which is a fancy term for knee scope or shoulder scope.
And what happens there when you do that?
Yeah, so what we're doing is just trying to make the arthritis as least symptomatic as possible. We're smoothing off the cartilage. If there's any loose pieces, we're removing them, things of that nature. But we're not, once again, reversing it. We can't fix arthritis through a scope. So if patients have had, and a lot of patients have had a knee or shoulder scope, you're just trying to improve the symptoms there. At the end of the spectrum, Joe, if you haven't gotten relief from a scope or something of that nature, that's where arthroplasty, which is, once again, a joint replacement, comes into play.
Wow, and DMOS would be the place to get all your answers for
Absolutely.
that, right?
We want to give a quick mention to Jingle Run that's coming up.
Yeah, the Jingle Bell Run.
Jingle Bell Run is happening when?
This Saturday, 9 a.m. at Colby Park, 6900 School Street in Windsor Heights. And it's our fundraiser, so we can eventually, we want to find a cure for arthritis down the road.
And that's what this is all about, too.
Yeah.
It's a run to help raise some money for arthritis, which really makes a lot of sense, because that way you can see what you can do if we just get a hold on what arthritis is all about.
Yeah.
And these kind of fundraising events, this is the key for the success,
Yeah,
right?
yep. Over 70 cents in every dollar goes to research for a cure or for better medications from the Arthritis Foundation.
Okay, want to get signed up for the Jingle Bell Run? Is it too late, or can we still do it?
No, you can still do it. www.
All the W's, just keep doing W's.
jbr.org
Okay.
/Des Moines.
Okay, what about the day of? Can we show up there the
Show
day
up
of, too?
the day of, 8 o'clock in the morning, and get registered and come join us.
Are you going to be out there?
I'll be there.
Okay, rubbing elbows with Danger Boy?
I will be.
Okay, make sure, okay, because of course, Danger Boy and the whole gang over there, they're going to be out there with bells on, jingle bells on, Michelle.
Bells on, of course. Well, thank you, gentlemen, very much for joining us. Go to dmos.com for more information on arthritis, or stop out to their clinic. There's lots of experts out there that can help you out. Stay